Hi, this is Aaron from Inside the Skev. I hope you enjoy this next episode. If you want to listen live, tune in Sunday mornings at 10 a.m. to WCGO. That's 95.9 FM, 1590 AM, or WCGOradio.com. Facebook Live at WCGO's page and Inside the Skev. To learn more about this great town and what I do, go to skevinston.com, and you could always contact me at aaron@skevinston.com. Now sit back and listen to this one message from one of our supporters, and we'll start the show.
Over the past 8 years, the JCC Chicago Jewish Film Festival has become one of the most important and highly anticipated events within the community. Now, for the first time ever, the festival is going virtual. That's 23 films, 16 conversations with filmmakers, authors, and experts, all from the comfort of your own home. It all begins Sunday, November 1st and runs until November 19th. Once you purchase a film, you'll have 72 hours to start watching it, then 24 hours to finish it. So you really get to enjoy everything you can at your own pace. For more information, visit jccchicago.org. To make sure you get the most out of this event, take advantage of the special film pass available for a limited time, where you buy 5 movies and get the 6th one free. Restrictions apply. Visit jccchicago.org for more info. The JCC Chicago Jewish Film Festival, November 1st through the 19th. View the schedule and get your special film pass right now at jccchicago.org.
Welcome to Inside the Skev, and this is your host, Aaron Masliansky. Great being here this Sunday morning, November 15th, and hope everyone's doing well. It's definitely been an interesting week in Illinois here with COVID numbers going up and everything else. So I hope you're all staying safe and healthy. And it's great to have you here to listen to the show. And before we get to our guest, I want to just open up with a few different thoughts and a couple shout outs to some very important people who are listening there in the audience. Number one, I want to wish a happy birthday to my wife, whose birthday is this week. She's going to be 29 again. And so happy birthday, Stacy. And I want to wish a happy anniversary to my friends Mark and Ariella Fiedler. They celebrated their anniversary this past week, and they told me that they're going to be listening on the AM dial this morning. So Mark and Ariella, I hope you guys are enjoying your Sunday with Sammy. Hi, Sammy. And I also just wanted to talk about something that I've been thinking about with how people can have conversations about political discourse. And there's an app that I use called Calm. It's great for meditation or different kinds of master classes. And they have something as part of the app on the Spark section that talks about how to talk about politics with people. And I think it would be really good for people to listen to that and try to figure out how we can all come together here. So just wanted to open up with that. But we are here. We have a special guest here today. We have Monica Rodriguez, and Monica and I know each other from the Chicago Council on Global Affairs. We are both young professional ambassadors with the organization. It's a great group. I've had them on the show and the podcast version, and we've been doing this for, I think, about 4 years now. We were talking about just before the show started. And Monica has a really, really, really cool job. She is the Director of Communications and Engagement for the All of Us Research Program at Northwestern University. So what this program is their mission is to speed up health research breakthroughs by collecting health data on, their goal is to get 1 million Americans signed up, people of all backgrounds, locations, everything else. And Northwestern is the lead here in Chicago. So Monica, thank you so much for joining us today.
Yeah, my pleasure. Thanks so much for having me on.
Yeah, it's a thrill. We talked about this, and I'm so glad that you're here for the radio version of this, so we could reach a lot more people.
That's right.
Yeah,
this is a huge effort, and we need as many people to get involved, and even more than that, we just want people to have the option to learn about it. And so, thank you so much for having me on.
You're welcome. I think what you're doing is very, very important. So if you could tell us a little bit more about the program, what really is it? How is it developed? And, how do you fund it?
Yeah, absolutely. So the All of Us Research Program, it is a historic program. This is a longitudinal effort. So we're, looking to do this for hopefully 10 years or more. And we're trying to gather, as you said, 1 million or more participants or people to share their health data with the program so that we can create a resource database and a biobank that will allow researchers to help accelerate research outcomes.
Wow.
So we want to take into account, all the individual differences that people come to the table with and that affect the way they receive healthcare. And this program is supported by the National Institutes of Health, so the NIH. And it really is one of the most ambitious programs that's ever been done in history. It opened in May 2018, and it is funded through resources that are appropriated each year by the Congress. So it first started, 21st Century Cures Act, which was passed December of 2016. That's kind of where the funding first started and began. And we have over $1.5 billion that are planned to go towards this program over the next 10 years.
It's almost like a space race for healthcare in a way. I mean, it's so important.
Yes. And that's actually a really nice way to look at it. We really are, the sooner we can create this kind of resource and database, the sooner researchers can go into it to start digging through the data and really coming, hopefully coming up with solutions. We're not just looking to help researchers find treatments, but we're also thinking from that preventative lens of, how can we educate each other to learn more about our own health.
That's what's so important. I've had some other episodes where I've talked about health and taking control of your health. And if you can get the data and the information about yourself, how to be proactive on different things. So if you know your vitals, your blood cholesterol, things like that, your DNA, there's so much more that you could do with it. It's so rich. But that's a gargantuan task to get 1 million people to volunteer their data when people have concerns about privacy or whatnot. So how do you get the people to sign up?
Yeah. So the program is open right now to participants ages 18 or older, as long as you live in the United States. Anyone and everyone is welcome to participate. And, the program, while it's completely understandable, that concern about data sharing and privacy. And so the program, takes that as a very important piece and very careful about how they store the data, how it is shared, et cetera, within, so that researchers can actually study it. Everything is de-identified. Every data point that you share personally, whether it's through surveys or through the, blood and urine samples we ask participants to share with us, as well as their electronic health records, all of those things become de-identified so that really we can, researchers are just looking at the data. And, as we build this database, while it's still small, we're also being very careful about, date shifting for, appointments, making sure that we're rounding up, making sure that there isn't a way for people to kind of dig into, well, who is it that responded to this? So there's a lot of safety measures that are in place to be sure that participants' privacy is really taken as one of our primary concerns.
Absolutely. I think you need that in order for there to be trust there. So it's great that you've taken all those things into account. So the program is nationwide, but how is Northwestern involved?
Absolutely. So the program is nationwide, and Northwestern is the lead site of the Illinois Precision Medical Consortium, which is made up of UIC, UofC, Rush, North Shore, along with a multitude of other partners that are in the city of Chicago with some of the federally qualified health centers. And, we're just really proud that Chicago is kind of on the map when it comes to, this program and health research. We have the national headquarters for the Asian American Health Coalition is here in Chicago. And, they're doing a fantastic work of helping to engage the Asian American population across the United States. Chicago also, happens to be the place right now where across for the whole United States, we are seeing, our Black participant community is primarily, our participants nationally are coming from Chicago. So we're seeing a huge supportive participation from several different communities in Chicago. We're really proud of that. There's still a long way to go to reach our goals. And for Northwestern, we are looking to recruit over 31,000 people just at Northwestern.
Wow.
Yep. So still we're at about 5,200 participants. So still a lot of room to grow, and for the city of Chicago for us to grow as well. Yeah.
Well, it's an important time to do this. Obviously, we're going through a pandemic, and health is number one on people's minds. One question I have is, how do people sign up?
Absolutely. So you can sign up by going to nm.org/join all of us. And that'll direct you right to the Northwestern page for all of us. It'll give you some more information, plenty of links to learn more about the program, or you're welcome to give us a call, 312-695-6700, so that we can get on the phone, talk to one of our participants, staff engagement team members, and they can walk you through any of the questions that you might have.
That's helpful to be able to have people walk through it. And you have people on the phones who can speak multiple languages, I assume.
That's right. So the whole program nationally, you can participate both completely in English and completely in Spanish. And we're hoping, as this program grows, that we're able to get more materials in a variety of languages. Obviously, one of the key components to, for this research program to be truly effective, we've got to have a very rich and robust data set. And for it to be rich and robust, it has to be reflective of the diversity of the United States. And so, wanting to make sure that we can be inclusive of as many people as possible, I think is a very important, a very big task, but a very important one. And so, right now you can participate completely in English or completely in Spanish. We have folks on the phone at Northwestern who you can speak with in Spanish. And for the part of the program that involves you coming in person and actually giving your blood samples and your urine sample and some of the other, kind of points of participation in the program, we also have staff who can do it completely in Spanish. So we're, available, trying to, make sure that, again, we're just as inclusive as possible.
That's key. And, and making sure that people can be, comfortable as they're going through it. Especially with COVID, and making sure that they're not getting sick while participating. So I'm sure that you are doing, tons to do that. But, one thing that I want to get to after the break is to talk about why this is important to everybody, because you've got so much information that you're gathering, and sometimes people don't see the what's the point of all of it. But I think we want to talk about precision medicine and how that's going to help people, and not just giving people, random medication, but things that really work for them based on their current health situation, genetics, whatever it may be. So I think that is what this program is going to, significantly help us in making a healthier Chicago, SCEV, and America.
Absolutely.
Reading, writing, and math are a struggle for a lot of students. At BrainLinks, we know those skills are what paves the way to independence and success. Our specialists will help your child develop the habits they need to make sure they thrive not only in class, but out in the world in general. And of course, for everyone's safety, our lessons are done completely online. For more information on our team members and to schedule your initial consultation, visit BrainLinksAcademics.com. That's BrainLinksAcademics.com.
Welcome back to the Inside the SCEV. This is Aaron. I'm sitting here with Monica Rodriguez, virtually sitting here with Monica Rodriguez from the All of Us research program at Northwestern University. And we are talking about this program that she is the director of communications on. And it's a great program. And what we want to talk about now is precision medicine and what that means and how this program helps make that happen. So Monica, tell us a little bit about precision medicine.
Absolutely. So we're talking about what is basically an innovative approach to disease prevention and treatment. And when we think about how we receive care right now, since about like the 1980s, medicine has been this very much this, you have some type of illness, we're going to treat that illness, right? It's been a little too much of that cookie cutter, one size fits all approach. And what we're trying to do is really take into account individuals' differences in environment, in lifestyle, and in genes. So what precision medicine really does is it gives, all of our, kind of medical teams, our clinicians, better tools to understand all the different complex mechanisms that underlie a person's health, disease, or condition, and then what treatments would be most effective based on that person's unique makeup.
Yeah. So what have we seen actually, like what is being implemented right now in precision medicine? How far along are we with this?
Well, I'd say, you're seeing a lot of the attention, I think, in this idea of precision medicine really being grabbed hold of by all of the, areas where there is the most more severe illnesses. So, think cancer treatments. A lot of people who may be, unfortunately, feeling like they have already expended all of their options have started to turn to, healthcare professionals who are taking this approach of precision medicine into account and treating some of these cancer patients from that kind of perspective of, well, let's look at your genetics. Let's look at, let's look at what you're eating, and let's look at the environment that you've been living in. And let's take a, kind of that approach to what might be a better treatment for you. So I think we've started to already see that in the medical community in a lot of different of the, kind of cancer areas, but we really are, there's so many questions that we can answer, and the researchers really, because I'm not the one who's studying the data, but researchers will be able to dig into this database and answer everything from how can we prevent the chronic pain that affects more than 100 million people across the USA each year. Yeah. Or like, how can we develop better pain medicines that aren't addictive, or develop better treatments for diabetes, which affects almost 10% of Americans, or prevent diabetes altogether. We're looking to develop better cancer cures that will work the first time, so that we can skip the kind of trial and error chemotherapy that a lot of people have to go through.
That's so important. And it's like with chemotherapy, from what I've heard from people, luckily I haven't had to go through it, is just where they're trying to take many different approaches to try to cure it, because obviously it's so terminal if you don't treat it properly. But this could eliminate maybe some things that don't work and affect your organs in a way that maybe from in your genetics works one way, but for somebody else who might be from another part of the world, it's going to work completely differently.
Right.
You could, it's so key. What is your prediction of when we'll be able to take all this research and make all medicine specific to the individual?
Oh, well, that is just like this research program is ambitious. That is an ambitious task. And I think we're taking the first steps towards it now. And, I don't think I have a projection of when this will change all of medicine, at least in the United States. But we're not the first ones to start kind of on this journey. The UK Biobank, which has about 500,000 participants, kind of had the first, kicked us off in this direction. And, when Obama was in office, this was one of the main initiatives, this idea of precision medicine. And this program, the All of Us Research Program, which again, requires all of us to participate, really was the next step for us as a nation to begin moving in this direction. Because health starts in our homes, in our schools, in our workplaces, in our neighborhoods, in our communities. And there's so many different aspects, or so many different things that can affect, our access to, social and economic opportunities, whatever resources we have. And so, we in order for this to really, I think, grab hold, we need the participation of everyone. And when we talk about, diversity in research, we're not just looking at diversity in terms of race or ethnicity. We're also thinking about age. We're thinking about income. We're thinking about education. The difference between living in a rural environment to to an urban environment, and how all those things impact the way that we receive care or choose to receive care or our access to care. And those, what we typically call social determinants of health, they explain in part why some Americans are healthier than others and why Americans are more generally not as healthy as they could be. And obviously COVID ties right into all of that.
Oh, for sure it does. And we're going to get to that. But what are some of the things that the study's finding right now?
Well, right now, again, we just within the last year, we made the database that is the portion that is free and open to all as a research. We're hoping that citizen scientists, we're hoping that your high school science teachers are going to be able to use this data in our data browser that is live and active right now. So you could go home today, Aaron, or you're at home, but you could go right now and, take a look at some of that data in our data browser. But in terms of like larger conclusions, the researcher workbench, which is the place where raw data is going to be held and where researchers who have kind of been, vetted for their particular research studies are going to start digging into, that stuff is kind of just beginning. So apart from some of the studies that are starting to take place with, COVID antibodies, we are looking forward to the first releases of kind of information.
Great. Well, we're going to come back after the break and we're going to talk about how it's working with COVID and what you're finding in your research and being able to implement right away. So stay tuned, everyone. We'll be right back.
In 2020, mortgage rates reached record lows. If you see homeownership in your future, the future is now. Beth Lewis at Cross Country Mortgage has the options and advice you need to find the perfect loan program for you. She'll get you pre-approved to give you an advantage over other buyers, and she'll close your loan quickly with a highly efficient process driven by advanced mortgage technology. Visit BethLewisTeam.com to get started. That's BethLewisTeam.com. Cross Country Mortgage LLC, NMLS 3029, NMLSConsumerAccess.org. Equal housing opportunity. Illinois Residential Mortgage Licensee.
Hi, I'm Aaron Masliansky, longtime Skokie and Evanston resident, host of Inside the Skev, and local real estate expert. As a community connector and realtor with Dreamtown Realty in downtown Evanston, I know firsthand what makes the Skev such an amazing place to live. When I'm helping my clients buy and sell properties inside of the Skev or out, I'm doing it with the best technology and support team behind me at Dreamtown. During the pandemic, I've been able to help my clients seamlessly stay on track with their home search. From immersive 3D Matterport tours, professional photos, to virtual open houses, my clients can find their homes safely and comfortably, and even from their couch. When you're ready to make a move, know that I'll be here to help. You can always find out more about me at skevinston.com/real estate. Again, that's skevinston.com/real estate, or email me at aaron@skevinston.com. Welcome back to Inside the Skev. This is Aaron here, and we are speaking with Monica Rodriguez from the All of Us Research Program at Northwestern University. And this is a very important program in terms of getting a lot of data on people's health within the United States. And we left off, we were about to talk about how the research is helping with what we're finding out about COVID and how that relates to our health and how we can better treat people. So Monica, tell us a little bit about it. What have you found?
Yeah. So, one of the things that the All of Us Research Program kind of announced when, once the initial stay-at-home order started, was 3 initiatives that were going to really help the scientific community. And just, by way of reminder, if you're just joining us now, this research program, we're not just studying one thing, we're providing a resource. So a database and a biobank that will be available to researchers. And so how we wanted to kind of assist assist the scientific community in, gaining some new insights about COVID-19 was one, we're able to test the blood samples from over 10,000 or even more participants for the presence of antibodies to show us, if there was a prior infection. And the testing will start and started on any participant who joined our program March of 2020. And the program's just going to continue to work backwards until positive tests are no longer found. The next kind of step is, a lot of participants, who have joined our program, we've collected really relevant information about their electronic health records that show us, if they've either been diagnosed or they sought healthcare for some related symptoms. This can also help researchers kind of take a broader look. And then lastly, we launched an online survey. We've already done it for about 4 months. And this kind of 20 to 30 minute survey was really designed to garner kind of response and feedback from people who have been ill with COVID-19 and even those who, have not knowingly been infected, to kind of get an understanding of the stress, kind of social distancing and economic impacts of the pandemic, mental health status, all of these kind of areas we're really looking at. And we already have this large pool, nationally, we have over 350,000 people who have joined the program. And we're able to kind of broadly already from this pool of people who are engaged with our program, kind of start to ask these questions and provide this information to researchers. And I should add, because it's, of interest and note, we're working with other organizations on COVID-19 initiatives, collaborating with the National Institute of, Allergies and Infectious Diseases, the National Cancer Institute, Centers for Disease and Control, the Food and Drug Administration. So there's a lot of partnership going on right now. And that is one of the things that all of us wants to be able to do, is be that resource, be that place where researchers can come to get some of this data and information that reflects, where we are as a nation.
It's so key. When looking at your research, when did COVID start?
Oh, so I would have to say that I don't have the answer to that. There are people who have much more scientific backgrounds than myself who are actually digging into that data and looking at it. So I don't know that that information is right now, available. And I should also specify that the data that we're collecting, this is a research program where we're trying to recruit 1 million or more people across the United States. So residents of the United States, doesn't matter your citizenship status, to share their health data. So we will only be looking at, and we'll hopefully be able to see in the future, kind of the development of the of COVID-19 in the United States.
Yeah. And I guess that you'll also be able to see what happens once hopefully vaccines start to be rolled out, and what the effectiveness is of it when you can compare it if somebody got a shot.
Right. And I think that's, that piece of information, which, how do you even begin to kind of pull that information? That's why precision medicine and that idea of looking at various data points to have a much broader picture and understanding and a robust data set makes such a difference. Because being able to, one of the parts of the program is we ask participants, will you consent to share your electronic health record with us and with the program? And it is de-identified, but that electronic health record data really gives us a much clearer picture of, what medications what symptoms did you have when you come in? What medications were you given? What treatment plans were you put on? And then looking that in conjunction with, a blood sample or a urine sample to understand a fuller picture, I think is the data that, that researchers are really craving right now as we're trying to get ahead, of this pandemic.
Are you using artificial intelligence to look at the data and to be able to make interpretations from that?
I think that's a really interesting question. And again, I'm not trying to put you off, Aaron, but we're think of it as we're the tool, right? We're trying to be the hammer or the crowbar, in different research organizations and researchers' hands. And so we're just collecting the information, and the list of of research questions that could potentially be answered from this research database that we're creating is innumerable. 2 years ago, when this program was in existence, 2 years ago, COVID-19 wasn't on the forefront of our minds. But, the pandemic hit, and we already had, hundreds of thousands of participants data. So that was already ready and available. So I think that's, we got to keep looking at it as we're not doing specifically the data, but there's a lot of other groups that in the future will be able to point to all of us and say, oh, I was able to use the All of Us database to help me in my research to answer some of the questions that you have.
Oh, it's so key. A friend of mine who I've had on the show, his name is Sam Glassenberg, and he runs a company called Level X. And what they do is virtual reality surgery and procedure training. And it's exploded in growth from what I understand during the pandemic because all these medical schools needed something to be able to have their students use. And this is a safe way to go about it. You could just do it on your phone. But I can imagine that taking the data of knowing how things are going, if you're looking at like simulation of treatment for medicine, and the data from, you have an adult male, 65 years old, overweight, this, smoker, this, whatever, from this genetic background, you'll be able to see what types of medicines may work. So a doctor can go into it and maybe they know what it's going to be right away, or they could plug in the information and then be able to pull up, oh, okay, they need this type of medicine and this type of diet plan, or, whatever it may be. And you can take all that type of data to really make it work for somebody. And I can also imagine that with the vaccine data, it's going to have where some people it's going to work with, hopefully everybody, but one vaccine may not work for one group of people.
Right.
We talk about with seniors, they may need a different type of vaccine than somebody who's, in their 30s. Right.
That's exactly right. And I think that's one of the hopes and promises for providers, and looking at the full list, not just physicians, but, all the different types of clinicians, allied health professionals, right? Having an understanding of having the research available, the data set available so that researchers can do the research, so that when you're in office, you as a clinician or as an allied health professional, you can you have that information to be able to, to look at, to be able to, give, better options or alternative options for, for a treatment plan, and even for preventative, measures as well. Cause I think that's a really important piece of this program. So you're hitting the nail on the head. We're hoping that this data set will eventually be able to be the kind of one of the pieces in the streamline of information that reaches your doctor, who can then has more tools to offer in terms of, treatments and preventions for their patients.
That's the key, make medicine better. And I think part of what Electronic Medical Records Act was to try to get data in there so doctors have more tools at their fingertips. But in many ways, what it's done is just make it easier to do billing and charting. And I know talking to several doctors that a lot of what their job now is just charting, but it's for insurance. And here you're taking the data to actually help improve the medicine for individuals.
Yeah. Yeah. Really making that a piece of, one piece of, again, what a researcher can look at and in layers. And the researcher workbench, which is the place that researchers will be able to go in and look at the data, will allow them to create their own cohorts, allow them to actually pull together all those different unique identifiers that you just mentioned of, whether someone is, a certain sex and a certain age, and maybe they're what their genetics already says about something, and then start asking questions. And so it really is a historic effort and an ambitious effort because of where it is that we're trying to go with it. And it really is the direction, that I personally feel like medicine needs to go. And I think you're already alluding to as well.
I guess that is what I'm alluding to. I think that it does need to go this way because it'll give people better care and it'll make the doctor's job more effective. So have you seen people, one of the things that I want to talk about is, do the participants, who are in the study, are they taking control of their health? And some of the benefits that they're receiving for being a part of this study. And we're going to have a short break, and we'll be back in just a few moments. But when we do come back, I want to just talk about that, because I think having control of your health, just like people do mindfulness for meditation to help with your mental health, being mindful about your physical health and everything else, it puts it all together, and then you can start taking control. And then if one person does it, and then 1,000 people, and then so on throughout our society, we all become a healthier America. So stick around, everyone. We'll be back in just a few moments and talk more with Monica. Thank you.
Moving day is a happy day, but how can you be sure all of your stuff will get to the new place in the same condition they left the old place? Upgrade your experience to First Class Moving and Storage. You'll get a team of professionals who treat all of your belongings with care and have the right tools to make the job go smoothly. They even offer a full packing service. Upgrade to First Class Moving and Storage. They're local and independently owned. For more info, visit the website at firstclassmovers.com. That's the number 1, stclassmovers.com.
Hello, everybody. This is Aaron. Welcome back to Inside the Skev. And we are here with Monica Rodriguez, and we are talking about the All of Us research program at Northwestern University and throughout the country. So hope you're enjoying the conversation, and we'll hopefully participate. So Monica, how many people are participating right now?
Yeah. So nationwide, we have over 350,000 people who have joined the program. And we have about 3,200, a little more, that have joined at Northwestern. Our goal is 31,000. So we still have a ways to go and a few more years in which to accomplish that. And I know that there's probably, I could say, some hesitation, I would say right now, since to participate in the program involves part of participation involves coming into our participant center to donate blood and urine samples. Sure. Along with, your basic physical. We do ask participants if we could take their blood pressure, height, weight, et cetera. But there are a lot of ways to participate from home. So, the initial part of the program involves going online. You can download our app, both, for Android or iPhone, the All of Us research app. It's a bright blue background. And you can begin the journey with us by choosing to consent to participate in the program. The app will also walk you through kind of what it means to receive back DNA data, since one of the big goals, and we hadn't really touched on this yet, of the program is to be able to return DNA data to individual participants. We are looking at participants as partners, not just trying to, take some data from you, but also give you back, as we were talking about earlier, tools to help you be a better advocate for your own health.
Yeah.
And so, you will make a decision about whether or not you want to receive back your DNA data, or maybe you're not sure at the moment yet. And then there are some surveys that we ask you to fill out. So there's a lot of ways, just from the privacy of your own home, to begin that process. Join the journey with us. We haven't reopened our participant centers since, the stay-at-home order first came in March. But we are looking to hopefully do that in the coming weeks and months, with all of the safety guidelines in place. So yes, please come join the journey, start the journey with us at nm.org/join all of us.
And is there a cost to participate?
No, there's no cost to participate. And, while, something like receiving your DNA, full genome sequencing would cost several $100s for someone to try and do on their own. And we're doing that piece, for free. That's part of our partnership with you. We do at Northwestern, if you're coming in person, we will, give you a Ventra, or CTA 1-day bus pass, or a parking pass. So, it's free to come and actually participate, as well as a $25 Visa gift card once you've, completed the donations of your blood and urine sample.
Okay. So that's great. I mean, there's no cost, and you get, free DNA. When you get the DNA sequencing, do you get like an analysis of it? So what it all means?
That's a great question. So we are in a very exciting part of the program right now, because this process is just beginning. The return of genetic information is just beginning. And the first piece of information that we're going to be giving back to participants has to do with ancestry and trait data.
Sure.
So information like, Erin, do you like cilantro? Do you like the taste of it? Because for some people, cilantro tastes kind of soapy. And,
Right.
and that's actually something in your genetics. So, information like that is going to be the first bits of information that we're going to return to participants. And, returning all of that DNA information, again, massively ambitious project, that's going to take time. So you're actually going to be receiving back information over time.
Yeah, no, that's great because we will learn so much more as time goes on. I think one of the things that people hesitated when DNA tests came out at first is, oh my God, I'm going to learn that I've got this disease that's going to come get me in 10, 20 years. But as time goes on and we build more precision medicine, we may be able to eliminate those diseases because we know about it, or we'll be able to make lifestyle changes in order to better prevent it.
Yeah. Yeah. I think that, one of the most motivating aspects of joining the program really is thinking about the generations to come, thinking about, your children. You've got a couple kids, Erin, how your involvement in the program and sharing your data for researchers will one day, help as your children get older and the environment changes. We discover not just new solutions, but also new problems come up, i.e. COVID-19 that hit us, it feels like out of the blue.
Yeah, no, but we do have to be prepared to be able to know what's coming next and be proactive with it. So I think that that's what's so key. Again, if you could remind us, where can people sign up?
Absolutely. nm.org/join all of us. You could also find us, whether you have Android or you have an iPhone, you can find us on the App Store, download the All of Us app, and feel free to give us a call, 312-695-6077, and we'd be happy to get on the phone and answer any of your questions.
Well, I think that what people have to take from this is that there's certain things that, we like our individuality here in America. It's our freedom. Yes. It's key. But we have to look at sometimes where we have to, provide service to our fellow citizen, to our fellow human. And I think participating in a program like this is providing that service in a very big way. Because if we can learn how to make each other healthier over time, that's going to help all of us. It makes us stronger as a people. So I really thank you for what you're doing, Monica, and I really hope people go and sign up and participate in this program.
Thank you. Thanks for having me on, Erin.
Oh, it's been a pleasure. And just wanted to leave everybody here at Inside the Skev just with a couple of things. I've had lots of great conversations with people about health or about how to take control of what you're doing. And you could find all those episodes on skevinson.com. And I even have a page on there all about COVID-19. So as we started in the pandemic, I had, the president of the Skokie North Shore Hospital on to talk about it. I've had different people on to talk about, mental health, just all different types of subjects that I think would be important for people to listen to and can help you. There's more information about me on skevinson.com as well. So I think that it's great to listen to. Next week, we're going to have on Dick Coe and Robinson Marcus. They're from the Evanston Development Cooperative. We're going to talk about accessory dwelling units in Evanston. And just wanted to remind everybody to stick around for the next show, the Hannah and Fred show on WCGO. Big shout out. And, just really want to thank everybody for listening and tuning in today. And please, please, please stay healthy, stay safe, participate in the All of Us program. And thank you so much. Thanks for listening to this latest episode of Inside the Skev. To listen live, tune in Sunday mornings at 10 a.m. to WCGO. That's 95.9 FM, 1590 AM, WCGOradio.com, or you can go to Facebook Live on WCGO's page or Inside the Skev. If you want to learn more about this great neighborhood or what I do, go to skevinson.com. And I want to thank every supporter of the show and all my listeners. Thanks so much.